introduction to the Big Data for Better Outcomes program. My name is Catherine Brett, and I'm going to start today by giving you a presentation on how to use GoToWebinar. Joining me here at IMI are Sandra Müller, who's my colleague in the communication team, and Colin Carroll, who is the scientific officer for the topic and who will give an introduction to the topic presentation. Joining us on the line, we have Kim Krins and Joe Torrens from Bayer, who will present the topic. Unfortunately, Stefan Porter of Novartis was unable to join us due to a technical issue at the last minute, but he is with us in spirit. And at the end, there will be time for questions and answers. So, how to use GoToWebinar. At the top right-hand corner of your screen, you should see your control panel. You can expand and minimize it. You can see your microphone status. You can make it go full screen, and you can raise and lower your hand to attract our attention. For the audio side, you have two options. One option is to listen with your computer's mic and speakers. If you have problems, you need to check that you are picking up the right mic and speakers with the system, and you can do that by doing a sound check. And you should also check if your speakers are switched on. And the other option is to listen in over the phone. Again, if you have any problems, you can try using one of the other numbers that are available from other countries, or else you can try listening in over your computer's mic and speakers. There are two options if you want to ask questions. The simplest one is to ask your question in writing by typing it into the questions box and hitting send. You can also ask a question over the phone. If you'd like to do that, just click on the raise hand icon. So before we start, just to remind you, this webinar is being recorded and we're going to publish it on the IMI website and the IMI YouTube channel. The presentation will be published online afterwards, and we will be circulating the participant list. So on that note, I'd like to hand over to Colin Carroll.
Okay, thank you, Catherine. As Catherine said, my name is Colin Carroll, and I'm a scientific project manager here at the IMI. And I'm managing the whole Big Data for Better Outcomes program and also this specific topic. So I'm going to give you a brief overview of the outline of the webinar, but also a few details on the IMI process and tips for submitting a successful proposal. So today's webinar, the bulk of the presentation will, as Catherine's already mentioned, be presented by the people who have actually defined the topic, and they will cover the topic itself, such as the objectives of the project, why they've chosen to go through a public-private partnership, that is the IMI, their vision of the structure of the project, what they expect from you, which would be quite important. So what is the expected contribution from the applicants, and also important is what the FPA, that is the pharmaceutical industry participants, are going to bring as well. And then they should finish off with a few key deliverables which you should address in your short proposals. So this webinar will not cover IMI rules and procedures. I will have a kind of a brief introduction to them here, but I would really recommend that you go to our dedicated webinar on the IMI rules and procedures, which is on the 20th of January at 3 p.m. Brussels time. If you cannot make that webinar, like this webinar, it will be recorded and the recording will be published on our website. And I would recommend either you view the webinar itself or you view the recording. Okay, so before I hand over to the topic presenters myself, I'm just going to go through a little bit of how IMI works, how the call process works in IMI, because it is different from Horizon 2020 or FP7. And there are a few peculiarities which I think you really need to know. And then I will go through a few tips to help you formulate a good proposal. So this slide is quite detailed, and I think it's necessarily so, but I will explain it, so I might spend a few minutes on this. And I think the important thing here is that you realize how a topic comes about into the IMI framework, and then how it goes through the topic proposal submission stage, the evaluation, and then the full detailed proposal submission stage. So if I start on the left, which is the topic definition phase, and this is when the topic itself is defined. This is before it's published as a call. And this is something you as public applicants do not normally see, but I should tell you there's a lot of work goes on in advance of call publication around formulating the topic. And the way this works is that there are various groups within IMI, within the FP and IMI umbrella, consisting of all the interested companies for particular disease areas or innovative topic areas. And these industry participants, through various discussions, agree on an area where they're willing to work together and an area they think it would be beneficial that they also work with academia, hospitals, SMEs, and so on to address a common need. And by discussion and by deciding where they should work together, these industry groups form the topic text, which you see in front of you at the moment, which is open for proposals. But importantly also, they identify what resources they are willing to dedicate to that specific topic. And through this, the budget for the topic is set. So later on in this presentation, the industry team will present what they are bringing to the topic, and they'll also present what they are expecting from you. But the important thing to note is that once the topic is launched as a call for proposals, then this existing industry consortium takes a step back, and we move into the stage one here, which is following call launch, which is where we are now, which is where you as applicants should address the call topic text. So I think the important thing to note here is that you as public applicants will consist of half of the eventual project consortium. The other half, the industry consortium, is already existing. Okay, so at stage one, where we are now, you're expected to address only the applicant part of the topic text. You're expected to form a consortium to make sure you address all aspects of the topic text. So that may mean that you have to reach out to hospitals, regulators, SMEs, patient organizations, and so on. The important thing to note here is that you must address everything that you're expected to address in the topic text, okay? This is somewhat different from Horizon 2020, where you can select a particular aspect of the topic to address. Under IMI, it's important that your proposal addresses everything in the text. Okay, so you have approximately, I think, 3 months or so to submit your short proposal. And following the submission deadline, all the submitted proposals are competitively evaluated by a panel of independent experts. And this is another difference from Horizon 2020, in that only the top-ranked consortium from the first stage will go through the second stage, okay? And the reason for this is because we only have one industry consortium. So only the top-ranked applicant consortium can merge with the industry consortium at stage 2 to form a full consortium, which then submits a full proposal, which is again evaluated by independent experts, and also and there's an ethics evaluation at stage as well, if necessary. And following that evaluation, if the evaluation is successful, then there's a grant preparation stage before project launch. Okay, so I think the key point here, or 2 key points here, are: 1 is that there's an industry consortium already in existence, and 2, that you must form your own applicant consortium to address the topic text. And this is probably the most important thing you should think about at the moment, is finding your partners to address that topic text. This is not so straightforward for IMI topics, because they're quite often multidisciplinary, and you may have to reach out to people who you have not worked with before. So I'd really recommend starting to form your consortium straight away. And I'll give you a few tips on how to do this towards the end of my short presentation. Okay, so moving on to a bit more practical elements of how to submit a proposal. So the IMI Call 7 is using the IMI Sofia submission tool. It's sofia.imi.europa.eu. If you go there, you have to, first of all, request access, which will give you a password, and then using that password you can have access to the tool, and submitting a proposal then is reasonably straightforward. If you do have any difficulty, please make use of the help desk, which you can see at the top of the top right of the little screen. There is a help desk link. So to submit a proposal, you need to fill in the proposal template. One very important thing to note here is that this particular topic is a coordination and support action, and there's a specific coordination and support action template, which is different from the research and innovation action template. So please make sure you use the correct template. Now, this is available on our website, and it is also available within the Sofia tool. Another important thing to note is that the short proposals must be a maximum of 15 pages long. Anything over 15 pages will be disregarded by the evaluators. And therefore, it's very important to be quite concise in your proposal, but you must also respect the template, which I've covered the main topics here in this slide to see the main headings, so you can see what you should address. As I said, following the submission deadline, all the submitted proposals will be evaluated against specific evaluation criteria. As you can see here, there's two kind of criteria of excellence and impact, with the sub-criteria mentioned here. Again, this is specific to the coordination and support action, so please make sure when you're writing your proposal that you do consider these criteria, as this is what the evaluators will use to evaluate your proposal. Okay, so a few tips to kind of make it slightly easier for you to write a proposal and hopefully increase your chances of success. First of all, it's obviously very important to read all the relevant material on the IMI website. We understand that there is quite a lot of information on the website regarding our calls. So you can contact us in the program office if something is not clear or if you have any questions. We have certain rules, some of which are different from Horizon 2020, so it's important that you respect those. As I mentioned again, please contact us in the program office with any questions. And it's very important at this stage that you do not contact the FPA topic coordinators. And this is to ensure fair treatment of all applicants. If they do get contacted, they will just forward the question to us anyway, so you may as well just forward the question directly to us at the IMI. The reviewers during the evaluation are instructed to only consider the information contained in the 15 pages of their proposal. So it's essential that you provide all information that they need to evaluate a proposal within those 15 pages. Okay, so that's important to know. As I already mentioned, please start working as soon as possible. Putting together your consortium is a difficult thing to do, so I would suggest starting straight away. This is a mistake people often make, is that they leave it too late to fully submit their proposal within the Sofia tool. I recommend finalizing and submitting your proposal the day before, if possible. That gives you plenty of time to ensure that if there's any last-minute emergencies, you have a few hours to spare. And there is a page on our website which contains more tips which you may want to look at. So there are a few mistakes which people tend to make when they're submitting a proposal, and this slide is hopefully to help you avoid making those. First of all, before your proposal proceeds to the evaluation, it must pass some admissibility and eligibility criteria. And again, as I already mentioned, one of the most common ones is people missing the deadline. You'd be surprised, but it happens more or less every single time. People leave it a little bit too late, and they're very rushed at the last minute. So again, please try to submit your proposal the day before. It's important, as I mentioned previously, to make sure your proposal does address everything contained in the topic. One of the eligibility criteria is an assessment of whether the proposal is in or out of scope. But if your proposal addresses the topic, this won't be an issue. We do have a template. Make sure you use the template. And one of the eligibility criteria, which people are probably familiar with, is that we have a minimum number of legal entities. Now, for coordination and support action, this is only one legal entity. However, you must make sure that if you you do have a legal entity from a European or Horizon 2020 associated country, from an EU country or a Horizon 2020 associated country. I guess, for example, one mistake people make here is if you are a Swiss organization, for example, you would not be eligible unless your consortium also has an organization from within the EU or H2020. Okay, so when you're thinking of forming your consortium and writing your proposal, just be aware of a few items, like making sure that while you do address everything in the topic text, you don't need to have multiple partners addressing the same thing several times. So it's important to be efficient and avoid redundancy between partners. As mentioned already, make sure you do address all those objectives. And one thing which people tend to focus on is on the excellence of the proposal. They spend a lot of time on thinking about their objectives and how they really aim to meet them in an excellent way. However, you should note in the evaluation that excellence and impact are weighted the same. Okay, so therefore it's important to spend equal time thinking about how your proposed project will have an impact against the criteria in the evaluation form. Okay, so to finish off, just to give you a little few tips on how to find project partners to help you form your consortium. First of all, network with your own contacts, and I would say this is probably the main way of identifying partners. You probably already have a good idea of who you think would be suitable for this topic. Make sure you make full use of your existing contacts. However, as I mentioned, sometimes in IMI topics we require a large multidisciplinary team, and therefore it may be also important to reach out beyond just your normal contacts to other type of organizations as well. And one way you can do this is perhaps by networking with the people on the webinar. As Catherine already mentioned, we will distribute the participant lists for those who have allowed us to. We do have a partner search tool on our website, and if you follow that link there, you'll come to our partner search tool, which allows you to enter your details of your expertise and also to search for other people's expertises, and hopefully that will be a way of identifying new partners for your consortium. The IMI has got contact points in every member state, and this is through our states representative group, and their job is to help you be as successful as possible in IMI calls for proposals. So I'd recommend you contact them. The full list is available on our website at that link. Horizon 2020, the EU program, also has national contact points, and you can look them up as well, and they have a very similar role to the IMI states representative group. And of course, you can network through some of the IMI social media, such as our LinkedIn group, and I hope that will help you to find partners as well. And again, I would try to do this as soon as possible to allow you to spend most of the time focusing on the content of your proposal rather than finding partners. Okay, so these are my details here. As I said, I am the scientific project manager on this topic, so if you do have any questions, please contact me at the email address there, infodesk@imi.europa.eu. Okay, so now I will hand over to Kim, who's going to lead off on this presentation. As Catherine already mentioned, Stefan unfortunately cannot make it, and I think Jill will present some of the slides later on in the presentation.
Okay, thank you, Colm. Just before I continue, because I got a message from Stefan that he is in the webinar, but Stefan, okay, he's trying to dial in, so maybe I will give it to start, and now we can see if he's able to get through. But Catherine apparently is asking for a PIN code. I just see the email now.
Okay, thank you. So I will look for him, and then if you go ahead, we'll try and get him in if we can.
Okay, thank you. So this IMI project is, as already indicated by Colm, it's a coordination and support action for the Big Data for Better Outcomes program. So a coordination and support action is a bit different than the other IMI projects. So if you can go to the next slide, please. So big data play a very important role nowadays, and the focus of the Big Data for Better Outcome is to come to a healthcare system that will be more outcomes focused and sustainable. And the goal of the Big Data for Better Outcomes program is also to exploit the innovation and opportunities that are being offered by large data sets that can come from a variety of sources. Now, within the Big Data for Better Outcomes umbrella, there are different teams of enablers, which are listed here. So the focus of this program is to come to a set of standard outcomes and to demonstrate value. We also want to come to or provide access to high quality and outcomes data, and it's also important to use data to improve the value of healthcare delivery. And finally, another focus of the BD4BO program is to increase patient engagement through digital solutions. So next slide, please. So the coordination and support action for the Big Data for Better Outcome is actually an umbrella that will coordinate the activities that are ongoing within the disease-specific topics. So below you see the projects that are currently published and for which the expressions of interest are being written. So we have the ROADS that's focusing on Alzheimer's disease, the hematologic malignancies, and the cardiovascular topics. And then there are also other disease-specific topics like the multiple sclerosis, as well as the multi-disease and multi-morbid patient topics. And what the CSA wants to do actually is coordinate all the activities that are ongoing within these disease-specific topics that focus on the Big Data for Better Outcomes program. Next slide, please. So, such an ambitious program with all different disease-specific topics that all focused on big data that requires some coordination across different programs. So what the CSA actually want to do is come to a aligned strategy in close collaboration with the key healthcare system stakeholders. And we also want to identify the necessary enablers, but also the barriers and opportunities that are there to support healthcare systems and the transformation to a more outcomes-based system. The CSA will also require an efficient management of the Big Data for Better Outcome initiative with a minimal administration. And we want to come to an integration of the findings across the different disease-specific topics and also to communicate the aggregated findings, because a finding in one disease-specific project may also be of relevance to the other disease-specific projects. We also want to establish a platform for all projects, so to get access to relevant healthcare systems and stakeholders. Next slide, please. So what is the Big Data for Better Outcomes CSA at a glance? So we will actually focus within the CSA on 4 key themes or enablers. So first of all, we want to define the program strategy and coordination, including an item on sustainability. We want to integrate the knowledge that comes out of the different disease-specific topics, and we would like to communicate and collaborate with healthcare stakeholders. And then a topic that's also very important within the Big Data for Better Outcomes is the use of standards and guidance of human samples and data. Next slide, please. For the CSA, it is very important that there is a public-private collaboration. Industry can definitely not do this on its own. And we definitely want engagement of patient groups, regulators, payers, HTAs, and also health policy makers, and that in addition to academics. We think really that this entire group of collaborators is essential for this CSA in order to make this a success. The reason for this is that we want to have appropriate buy-in from the different stakeholders, and we also want to deliver an impact in transforming the healthcare system. And we also want to ensure proper data protection, because we're focusing on big data, and it's key that we ensure the protection of the individuals, that we ensure the privacy, and that we cannot do everything that we want with all this data. So we think it's important that there is a collaboration between healthcare stakeholders and that there's also an alignment with existing projects. Next slide, please. So what are the objectives of the full project? So as mentioned earlier,
sorry, Kim, sorry, just to interrupt you. I think we may have Stefan on the line. Stefan, can you hear us? Hello? No, apparently we still have a problem with him. Sorry to interrupt you, Kim. Please keep going.
So what are the objectives of the full project? As already mentioned, we want to come to a health outcome strategy for the Big Data for Better Outcome program. This means that we would like to establish an enabling platform with the different stakeholders, and this is necessary to support the quality and the consistency of the individual projects. We also want to operationalize the strategy to ensure the quality and consistency, and we want to identify opportunities for additional research action projects. So we already have a couple of projects ongoing, and we really want to have a good view of the upcoming projects so that we come to an integrated strategy. We also want to integrate knowledge from the projects and synthesize key learnings that can be communicated and by which we can drive the health outcomes focus. And it's key to ensure alignment with the distributed data network project that is upcoming. Next slide, please. The CSA wants to be a center of excellence to exchange knowledge and learnings across projects. And of course, we want to disseminate and share the aggregated learnings among all stakeholders. So as said, we have different disease-specific topics, and there will be common themes that pop up across these different projects, and it will be important to come to learnings across the different projects, because the learning from one project may apply to another project as well. We want to develop standards and guidance for the use of human samples and data, especially in the context of data privacy. We want to identify and address common issues across the disease-specific projects. And of course, we want to support the overall IMI objectives to reduce attrition and to allow faster access and to ensure better outcomes. Next slide, please. So the IMI call is, of course, pre-competitive in nature, and the advantage is that this will allow pharma companies to collaborate with a set of different key stakeholders, like academia, like payers, like regulatory bodies and patient organizations. And as said, the aim is to come to outcome data to support a sustainable health system. We expect to allow for a better use of scarce resources at the moment, because I think everybody is fighting for resources, and by coordinating all the activities that are going on within the disease-specific projects, we believe that this will add some value to that. So next slide, please. So what is the expected impact on the R&D process? We want to come to a value-based, a more outcomes-based healthcare system that is also sustainable. We want to leverage the output of other IMI data-related projects, and we want to optimize the investment in additional research. So that also reflects to the previous point that I made, that we need to make better use of scarce resources within the healthcare budgets. Next slide, please. So what is the suggested architecture of the project? As already mentioned, we have the 4 different key themes that are proposed by the private consortium. So we have the program strategy and coordination, the integration of knowledge across the different disease-specific topics. We will communicate and collaborate with healthcare stakeholders, and then we have the data privacy work team. Of course, other structures can be suggested as well. This is just a proposal that comes from the private sector. So next slide. Yeah, this is actually, again, the program strategy and coordination, so the proposed work teams, but as said, there can be some deviations from that as well. Next slide. So the first work team, it's on the overall strategy. It's for the program management and coordination of projects, hopefully with minimal administration, and we want to also ensure consistency, synergies, and sustainability of the projects. The second work team is on knowledge management. So we want to establish an initial repository of knowledge. We want to define knowledge domains, and we want to distill findings and key learnings across the different projects that can be then communicated to the other stakeholders. Work Team 3 is on the collaboration with healthcare system stakeholders, dissemination of program findings, and of course the establishment of communication channels with key healthcare system stakeholders. Next slide, please. Then we have the fourth work team, which focuses on standards and guidance for use of human samples and data, and I think my colleague Jill will give an update on that.
Thank you very much, Kim. Thank you very much. So my name is Jill Teuring, and I would like to present to you our vision of Work Theme 4. I do this because it's of course very closely related to the Big Data for Better Outcome projects, and of course very much related to big data projects as such. But it also covers general aspects in connection with human samples and clinical data. So I would like to give you an insight of what we would like to see in this work theme. This work theme 4 is supposed to address data privacy issues in connection with human samples and data. These are of course crucial for the Big Data for Better Outcome projects, but we feel that they are also crucial for the healthcare sector in general, where, as you all know, technological advances allow the use of increasing amounts of human samples and data for the development of personalized medicine. So this requires to obtain a common understanding of the applicable laws of data privacy, such as the new EU General Data Protection Regulation, and then, of course, a balancing of interests of patients on the one hand and research interests on the other hand. Accordingly, we feel that there should be a focus in the coordination and support action to create transparency when it comes to the application of data privacy laws in connection with human samples and data, and to develop uniform standards and to provide guidance in connection with patient-informed consent forms and related data privacy aspects. So what is the main goal of this work theme? It's, as I stated before, the development of uniform minimum standards for the use of human samples and clinical data, and if we are successful, it might also cover potentially the development of informed consent templates. And those templates could be used for clinical studies, also for other studies such as preclinical studies, as you all know and might be aware of. There is a lot of research going on with human samples nowadays and clinical data, and this will still increase. And also for donation of human biological samples of patients and healthy volunteers outside clinical studies, such as in case of biobanking. This work theme also is in connection with complying with privacy regulations, of course, which we would like to comply with when conducting big data projects. So we'd like to go back to the Big Data for Better Outcome projects and report on the findings we make in this work theme 4. So the deliverables would be, as stated, development of minimum standards and ICF templates, but also the development of guidance documents. So we aim at supporting, of course, the Big Data for Better Outcome project and also the healthcare sector as such when it comes to the use of informed consent forms. So we would like to facilitate work with informed consent forms and facilitate work when it comes to big data. And when dealing with related common data protection issues that we all face nowadays, such as what is the right terminology, when are data protection laws applicable? Are they applicable to human samples? Are they applicable to cell lines, xenografts? Buzzwords would be what is pseudonymization versus anonymization? How does data density play in here? does data density prevent an anonymization in compliance with applicable data protection laws? What are data protection mechanisms? What needs to be covered in patient information versus what should be covered in the informed consent as such? So these are only a couple of buzzwords and examples, and is supposed to show in what direction we think this work theme would be interesting. We also think that we should offer training and educational guidance for big data for better outcome projects, of course, but also for IMI and IMI2 projects and non-IMI related addressees such as patients. Next slide, please. So what is the working basis? It's of course the new EU General Data Protection Regulation. It's also the local laws and standards. And we think that an alignment with national and international data privacy initiatives is crucial. So let me start here with the examples from the end. Transcelerate, for example, is a non-profit organization to ensure collaboration across the research and development community. CTTI is the Clinical Trials Transformation Initiative in the US. They have an express informed consent project. And then the one in the middle, there is actually a typo. It's called Industry Pharmacogenomics Working Group. So it should be I-PWG. And it's a loose association of pharmaceutical companies. And they are also very much involved in data privacy issues and development of standards for informed consent forms. And we do not want to duplicate work here. We would like to align. We think that a minimum of 7 European countries should be involved in order to facilitate harmonization, including Germany, France, Spain, and Italy. And most importantly, this is not a topic that only applies to FPIA, but even more so applies to all stakeholders in the healthcare sector, including academia, academic research groups, European biobanking organizations, IT companies, of course, biotech companies, regulatory authorities dealing with data protection in healthcare, patient organizations, and medical associations. So any of those stakeholders are very welcome to join the project as part of the public consortium. Thank you very much.
Thank you, Jo. Kim, it's back to you, I think.
I think Stefan will give it a try again, but I'm not sure if it will work.
I'm trying. I don't know whether I can be heard.
We can hear you. Go ahead.
Ah, wonderful. Apologies for the hiccup of not myself not being able to join in the beginning. So I would then like to take from Kim to guide you through the remaining slides. The first one of those being expected contributions of the applicants, which in essence indicates what we, the industry consortium, feels the capabilities and expertise from the public partners which are needed to then go through this project or through the CSA successfully. And the first bullet point describes which contributions, in addition to what is coming thereafter from the more academic-free oriented groups, which contributions we think are of big interest for this, which are the regulators, the payers, HTA bodies, healthcare providers, and health policy makers. Since if then this CSA successfully supports the projects which generate new evidence, this is not meant to be just evidence to be published, but also to be then used by those groups which I just described to then see what the value of this is and potentially modify the approach to risk-benefit assessments which have been ongoing in the past to a potentially different level. So in our view, engagement in one form or the other of the payers, regulators, health HTA bodies and health policy makers seems essential. In addition, then, knowledge and expertise in healthcare system decisions, especially around outcome matrices and measurements to have a better feeling on the impact of procedures and activities of healthcare providers on the overall health outcomes for both the individual patient as well as for the population as a whole. In particular, real-world evidence, this is absolutely important. We are not speaking necessarily about evidence generated from randomized clinical trials, but post-registration of medications, post the point that procedures, surgeries, physiotherapies, everything is of interest, is put into practice. This is, of course, all very good, but if we then collect the data, we also need to manage them. We need to manage the knowledge which results from the analysis and the data sets which we then generate with this CSA-guided work in the project teams of the BD4 initiative. And so expertise in data knowledge management is essential as well, which any consortium which applies should have within the ranks of this consortium. On the next slide, expected contribution of the applicants 2 out of 2. Jill described the elements of the work theme 4. Of course, then it would be highly valuable to have expertise in the public partners consortium addressing the legal, ethical, data privacy and compliance aspects of the management of the sensitive personal level data, as well as on handling anonymized, pseudonymized data, which type of data to use and which type of data to then transfer from one environment to another, for example. And as I said in the very beginning, since this CSA is not to guide the projects only to generate evidence, but to also get this known to the relevant bodies, the regulators, payers, health policy makers, and so forth, expertise in outreach and communication of the results of the knowledge to the relevant people, to the general public or the healthcare profession at large, or high-level experts in the field who then will later on be able to decide what to do with this new data. The last 3 is more or less content-oriented, the project management experience. We would think that we have quite a large number of potential partners in this consortium. The industry consortium is already rather large, and due to the multidisciplinarity of the topics and the expertise, the contributions of the applicants expected, there will be certainly more than one, which is the legal minimum, which Colm referred to earlier. So there will be quite a few academic partners as well, and so this requires project management experience. The last point, though, is very important as well. Although we think it will be a large number, it shouldn't be too large either, since then it becomes just not practical to operate on a daily basis, and a lot of coordination effort then would cost a lot of time. Therefore, we have to, well, we feel, and IMI feels, that the size of the consortia should be carefully balanced with covering all the disciplines against having too many, which would make it too difficult to operate. On the next slide, I would refer to the contributions which the industry partners plan to contribute. It is fairly similar, if I may say so. It is the health economics and outcomes expertise. It is value-based healthcare, real-world evidence, tools, analytical, statistical analyses of this type data, experience in the discussion with regulatory, HTA, payers, authorities, patient groups, not to forget, very important point. And therefore, we would then involve the respective departments of the FPR partners in those discussions as well to contribute. Benefit risk assessment, pricing, reimbursement is in the same line of thoughts. I refer to Jill's work theme 4 presentation. Of course, the people involved in industry in these matters should also contribute. Then the communication aspect should also be covered by the industry. Data knowledge management, built up of initial repository of knowledge, the same for the industry partners, and governmental affairs and project management for the overall activity. On the next slide, what is in for you? I refer to the authorities on the first point. We feel it would be, or it is hopefully of benefit for the authorities to then comment and contribute and co-design what is being done to generate health outcome data, since, as I said earlier, the authorities are expected to then work with them or analyze them or use them for making decisions on future healthcare provision. And if then the authorities can say what data are expected, then this consortium has a much better chance to produce meaningful evidence rather than evidence to be published and then to be forgotten. So from this point of view, this is in a sense in for you, a potential to co-shape the type of evidence, the level of evidence, so that it is of value to you. Patient organizations is very similar. Health outcomes is around the patient, so the patients should benefit from being able to make their viewpoint known to the consortium, so that the consortium then can reflect the patient preferences and include the patient viewpoints into the research work of the individual projects. And one of the 4 columns of the second slide was actually patient engagement through digital solutions, which is just one potential aspect of patient engagement and patient organizations. And this CSA are more than welcome to then also suggest other ways of collecting patient inputs and referring to the patient preferences. Research organization goes without saying, new concepts to develop the appropriate matrices, to define the matrices, to develop new methodologies, to collect data, and to analyze, digest, or aggregate data, including real-world evidence. And here in the CSA, we feel, the research organizations are driving it at the pulse and hopefully cross-fertilizing each other. Small medical enterprises, here we thought mainly of, again, knowing what's going on in the field, co-developing new approaches and then finding solutions developed by the SMEs for health policy makers, for industry, and for the healthcare providers. So this is what we feel are the benefits for these different types of potential partners in the academic consortium to apply for cooperation with CSA. The last slide, key deliverables of the full project, is in a sense summary of what has been said. The strategic drive, the overall strategy and coordination of all the projects of the big data for better outcomes. Needless to say that this should be beyond big data for better outcomes. If other projects within IMI and outside IMI are touching on this project, of course, this CSA should be aware of it and integrate that expertise as well as communicate the results of the BD4BO to the other initiatives. Information and management of knowledge from projects. It's clear we want to generate evidence, make it available to stakeholders, but also keep it. So ensure sustainability in the form of a repository. Communication collaboration with healthcare stakeholders. I don't think I have to say much more on this. And also the last point, Jill explained the activities planned for the work theme 4 within the CSA. And with this, I would like to then finish the comments on this presentation. Thank you.
Thank you very much, Stefan, and thank you also to Kim, especially for stepping in at the last minute there, and to Jill as well for presenting. It's now your turn to ask questions and answers, everybody else. As I said at the beginning, you can do that in two ways. You can ask a question through the questions panel, just type it in and hit send. If you want to ask a question over the phone, then click on the raise hand icon. Obviously, this isn't your last chance to ask questions about this webinar. You can also send in any questions you have, whether it's about the topic or about the rules and procedures, to IMI, to infodesk@imi.europa.eu after today. I will also add that all of the documents relating to this call, the call text, all of our rules, everything is all available on the IMI website. And as Colm said, we really would advise you to read it carefully. It may seem like a lot, but it really will help you to avoid a lot of basic mistakes and to make sure that you really understand what you're getting into and what you need. We have a couple of questions now. One is from Win-Yan Colt. Why is it limited to 2 years, whereas the whole BD4BO program extends well beyond this?
This is Colm, so let me start and then I'll hand over to Stefan, I think. So you will see from the call text that indeed the indicative duration is 24 months. However, the subsequent paragraph is about future project expansion. We do expect this project to cover the whole BD4BO for Big Data for Better Outcomes program, and some of those topics obviously last a lot longer than 2 years. So we will expect there to be future project expansion, and I'll let Stefan explain the reasons why.
Yeah, the main reason for this was that we would want to continue learn by doing, so to speak. We weren't sure what the results will be, what the needs will be in 2 years' time, how the topic will evolve, and we felt that sort of continually adapted form of the CSA would serve the overall project better than having a fixed structure in place for up to 6 years, which would be much more difficult to adapt in case the needs of the CSA did change. So this is the main reason. So we could sort of engage different partners if needed. We could modify the issues as needed. We could address new topics as needed during the course of the next, say, 8 or 9 years or so. And that was the main reason, to maintain flexibility in supporting the BD4BO initiative.
Okay, thank you. We have a question from Deepak Kalva. Where can we find out more information about the European Distributed Data Network?
This is a somewhat difficult question to answer because the DDN is a future topic. Now, in this call 7 call text, there is kind of an introductory section to the Big Data for Better Outcomes program, and there is some very brief detail on the DDN there. However, we will be hoping to launch this topic as a call for proposals later this year. So I can just ask you to please be patient, and you will find out more details about this, hopefully in the near future. I would say just keep an eye on our website, and kind of a pre-publication version of that topic text should be available in maybe a month or so.
Okay, thank you, Colm. Nicola Rokovic has a question. Does a consortium have to consist of out of a mixture of private sector and public institutions, or can it consist of a minimum of 3 public institutions from designated countries? I think that's for you, Colm. It's on our rules and procedures.
Yeah, I'll take this one as well. So, under the Coordination Support Action, a consortium can be just one organization. However, I think I did mention earlier that this one organization would then have to come from the European Union or Horizon 2020 associated countries. The question, where do you need a mix of public and private sector? So I think the important thing to note here is you would probably be applying, you'd probably be interested in what type of organization is eligible for funding. Now, IMI is slightly different from Horizon 2020 in this aspect, in that we generally fund, academic and research organizations, non-profit research organizations, non-profit patients organizations, SMEs, and mid-caps. So the private organizations that we fund would be SMEs and what we call mid-caps, which are organizations with a turnover of up to 500 million euros per annum. As I mentioned at the start, the industry consortium, which Stefan, Jill, and Kim are part of, is already in existence. These are the big pharmaceutical companies that you see listed in, and the other organizations you see listed in the topic text. They're already in existence. They're ready and waiting for the winning publicly funded consortium. So you do not need to contact them, and indeed you should not contact them. They will join the winning consortium. If you have other private sector organizations that are interested in joining, by all means, please bring them into your consortium. But be aware that if they have a turnover larger than 500 million, they will not be eligible to receive IMI funding.
Thank you. We don't have any other questions for the moment, but again, this is all information that's in the documentation. A couple more questions just dropped in. Laszlo Benti says, will the CSA work in close collaboration with all the BD4BO projects, or would it rather work independently of them? Stefan.
Yeah, the idea is clearly that we work in very close cooperation with all the BD4BO projects in aligning those projects, in ensuring that the data and knowledge generated in these projects is indeed, in a sense, aggregatable, so that we could distill it up to a higher level. So in the case of hematology or Alzheimer, that they would not, these projects I mean, would not generate data very specific and very relevant for Alzheimer, but of no use for general healthcare considerations. Therefore, we have to work very closely with all of these and other similar projects outside IMI to then make sure that all the knowledge which is generated in those disease-specific projects can be used for general healthcare considerations and questions by health policymakers. So the idea is that the project leads of those projects are indeed in regular exchange, both among themselves as well as with the CSA, and pending the discussions between the academic and the public consortium after the winning consortium has been selected, that then the idea of a coordination committee or somehow activity is ensured by that full project proposal, which is developed by the public and private partners later on.
Thank you. We have a question from Danielle Dupont. The core text seems to include up to 25 industry partners. Is it expected that the ideal consortium would include a similar number of public and private partners?
As I said in my, unless Colin wants to make a remark, but my response to this is no, there is absolute freedom by the public partner to select the number of partners in that public consortium. The main thing is that all the deliverables and objectives are addressed by the public partners, and my personal plea is that is not too many. Actually, if it was another, say, 40 public partners, then I feel it would be very difficult to manage the coordination between all these partners. The main issue is that the objectives and the deliverables are addressed, and there is not really a target number of partners within the academic consortium as far as the industry partners are concerned.
Okay, thank you, Stefan. Colin, do you want to add something?
I have nothing really to add. I just to echo that. I think so long as all the objectives written in the call text are met, then the type of organization, the number of organizations you get is not so important. However, it is very important that you do realize that managing a large consortium does represent a large burden, and avoiding the management overhead as much as possible is probably quite a good idea, as Stefan's already mentioned.
Thank you. I think for the moment that's it for questions, and there are no other raised hands. So I will remind you again, go to the website if you have questions, get in contact with us. We are here to help you. I will say thank you very much to our speakers, especially to Kim for stepping in at the very last minute when Stefan had some technical difficulties joining us. Thank you to Colm as well for all his answers, and I wish you all very good luck with your presentations. And thank you for joining us today. Goodbye, everyone.
Yeah, goodbye, and apologies again from my side for having this trouble. Sorry for that. And bye-bye to everybody.
Okay, goodbye.
Bye.